So, let's zoom on. This thing is up, but people should be here.
I agree with you.
So it'd just be director. And
Wait a minute, why aren't we reporting to the Board of Health?
well, that's a mistake. I crossed that out of the one I went through. Because I worked on this the other day after I got it. You know, if nobody's gonna be on, there's no reason we have to Zoom it legally.
But we all know we tried. That's all I will say.
Fail
So-
to enable.
Oh, there's somebody. Great. Okay, so, let's do the director instead of administrative.
Okay,
And then we had a pay grade last year when we put this on. Jack just put TBD, but we probably want to put the same one as we had last year. And then we took that.
can what?
I feel like you're not, because
Oh, we can't see. I mean, you can't see us.
Is this on? Oh, so what? You want to do that? So then we cross out Board of Health, primary purpose of position, and again, take the word administrative, just the
That's
directors.
interesting, back to with the mouse.
There you go. Oh, interesting.
didn't know it could do.
Good job, Lee.
That was a total accident.
Okay, so on this first part, I'd be take out administrative and just put the director.
Should we close the door? Thank you, Ellen.
Is responsible for day-to-day operations. And basically the difference in the two duties is the billings and the directors, and it's not in the base managers. Other than that, the duties are all pretty similar. And it's just a matter of getting the verbs to agree and all that kind of stuff. So it'd be the administrative directors responsible for day-to-day operations and administration
Hold on, you can't be seen.
of the Jefferson County. I guess an important thing is we can be heard. Ambulance services, period, because we're taking out base manager, and supports countywide first responder service and the county EMS Association. Plans, organizes, coordinates, and evaluates functioning of ambulance services, conducts training and supervision of staff in order to ensure delivery of consistent, high-quality care throughout the county. And that should be a capital R, represents the department and county at local and regional let's put local, comma, regional and state meetings. Essential duties, is that first paragraph okay?
County represents the county, no, the department and county at local, comma, take out and regional.
Correct. And state meetings.
Yeah,
Essential duties and responsibilities, following duties are normal for this position. And this is where there was a lot of duplication, so hang on.
can we go back to pay grade?
Yeah,
I like leaving the to be now, to be decided later.
and that's fine, but I can tell you last year when we advertised, we had to put a pay grade, some base amount in there because we were told we wouldn't get any applicants.
Okay, and that's probably correct, but then I would like to take it to like what it was last year, 80,000.
Yeah, that's fair. I mean, we're not really deciding anything. We gotta approve this, but we can put it on there and approve it when we approve the job description. Does that work, Lee?
Yep, I'm fine.
80. Okay, because again, this is a work session, we're not deciding anything. The following duties are normal for this position. These job duties are not to be construed as exclusive or a specific list, and other duties may be required and assigned by the Board of Supervisors, period.
take out Board of Health.
I don't know where they got that at. I think it came from the Bureau of Trauma at the state, so a state Board of Health, Bureau of Trauma. But that's since been renamed, which you'll see in this next section. Okay, administrative, responsible to comply with all state and federal rules and let's put state, comma, federal rules and regulate, no, we do need the and, sorry, and federal rules and regulations pertaining to applicable ambulance and EMS services and complies with all regulations of the Iowa Department. I think it's Health and Human Services, Bureau of Emergency and Trauma Services. See, it used to be Public Health, but it was renamed recently by the state. Prepares and manages the budget, prepares and presents regular reports to the supervisors, develops and administers the annual ambulance budget in cooperation with the Board of Supervisors, monitors expenditures and receipts, identifies improvement opportunities, financially plans for future equipment and personnel needs, communicates timely, accurate information to the Board of Supervisors, Medical Director, EMS
Two
and
and three
Advisory
seem kind of the
Council.
same thing.
But
Your points 2 and 3 kind of seem like the same thing.
there's a lot of redundancy in here. That's why we need to, yeah.
I mean, it's,
So they're both budget related, is what you're saying.
Yep. What does financially plans for future equipment and personnel needs? That's
It means,
that also feels like part of the budget.
yep,
correct.
it's like future equipment planning, like ambulances.
Plans for future needs. Why do we have financially plans? Shouldn't say plans for future equipment and personnel needs as budget allows.
Okay, let's go back to these two that deal with budget and see if we want to combine them. I would say we could either use 0.2 or 3. Which one do you like better? Because they're both deal with budget.
They say the same thing, one's just wordier.
Mhm.
I would take out the wordiest one.
That works for
Simpler
me.
is better.
Simple is best. Okay, so this one with financially plans, do you want that in or out? Or just put plans for future equipment and personnel needs?
Within the budget constraints.
Okay, I'm gonna take out financially and just put plans for, because that would assume financial, wouldn't it?
I would think so.
Does that work, Lee?
Yeah, I mean, you can leave that in there, but we prepare and manage the budget, prepares and presents regular reports. Board supervisors, you've left that one in there, so. I mean, yeah, I think, planning for future equipment and personnel needs.
Within budget constraints. That's what Susie added. Sound okay?
Well, I think that's. I mean, I understand within budget constraints, and that would fall, I think, under our purview to a certain extent, if not entirely, but
You're absolutely right. It should.
to my way of thinking,
Mhm.
right, wrong, or indifferent, future equipment is going to be a necessity.
Yeah.
Okay, when you replace an ambulance,
You got a plan
we
for it.
gotta plan for
But we
it,
need,
how we're gonna
we
fund it.
need to have it within our budget constraints. We can't just have them.
We do, right,
We, the three of us.
right, but as far as a job description, I don't, and personnel needs. If you don't have enough medics to operate, you gotta go find them. I mean, so I just
So-
think planning for the future equipment and personnel needs would be part of the reports to the Board of Supervisors, so we could go up to that other line, is all I'm saying. But it does fall under our purview.
And you might want to make it that they advise you
Yeah.
on any planned needs
I mean, you know, they would
equipment.
advise us on what their needs are, then we gotta figure out.
And that'd be planning.
Yeah,
So you want to take within budget constraints out, since that's our job?
Yeah, it's our job, you know,
Mm-hmm.
they come and say, gee, you know, I need, white socks with red polka dots.
Mhm.
So we'll say, okay,
Okay,
so I'd like to look at what they've been doing,
sure,
which is coming to us after they've already hired somebody.
right.
And we have to approve it. I kind of like to, we need to be responsible and look at things prior to that happening.
and that's,
Because we are the three
Right,
people
I agree.
bosses.
that's why we're meeting with Judy, so we can
Yeah,
communicate
yeah,
things
yeah.
like that.
You got a lot of scratches on it.
I know, I've been working on it. Okay, so is it okay if we say plans for future equipment and personal needs, period, or do you?
Yeah, no, I think
All
that,
right. Communicates timely, accurate information to Board of Supervisors, medical directors, EMS, and advisory council.
and state of Iowa, because they have to report. They have to send the reports and they have to be there after the incident reports have to be there within 24 hours.
Okay. And state of Iowa. Prepares updated reports as requested.
Well,
See,
can
that's
I
just
back up? Can
redundant.
I back up?
Sure.
So communicates timely, accurate information to the board of supervisors, the medical director, EMS and advisory council? Do we report to the advisory council? Okay, can we take that out?
I think so. I mean, you are on the advisory council.
Sort of. Yes, you're correct.
So go EMS and state of Iowa.
Yeah, and it's a requirement by law that they,
Yeah.
This next one prepares updated reports as requested. Isn't that kind of covered in other stuff, or do we need that?
yeah, because it says presents regular reports. The board of supervisors.
So can we cross that out?
Mhm.
Yeah.
Okay, oversees, directs, and maintains the overall operations of Jefferson County Ambulance Service, and it seems like that's. We've already got that in that first bullet point.
That should be taken out. That's very redundant.
That's why we're doing this. Remember, this is two combined as one, so there is some redundancy.
Yeah,
And here's a verb change, just acts instead of acts as a representative for Jefferson County. And we already have that up above. In, let me find it. Maybe not, I'm not seeing it. Oh, represents the department in county at local, regional, and state meetings. Wouldn't that be the same as acts as a representative?
I agree with that.
All right, is that okay with you to take that out, like access?
Yeah, because I was gonna ask you to take out in all aspects of public relations because
Where's that? Oh,
It's
yeah,
the
that's
same
out, yeah. Okay, purchases equipment, materials and supplies in accordance with the budget and cost effectiveness. That seems redundant. I don't know. Determines,
on the determines long-range capital and equipment needs, in consultation with the board of supervisors.
prepares bid specification, reviews bids and purchases equipment in consultation.
In consultation or
With board of supervisors.
with this, our approval.
Well, they need to talk to us first.
That'd be a good idea.
Now, is that duplicate of what we have above about the plans for your future equipment needs? I guess you got a plan before you purchase it. So it's probably okay. Effectively, and again, here's another wordsmith, effectively works with county, city, and hospital officials, patients, staff, and the public. Any comments there on that? And then again, some wordsmithing, promptly handles complaints and other concerns. And I crossed out this other related duties because we already had it up above.
Prompt handling of consumer complaints and concerns.
I crossed out consumer and just put prompt handling of complaints and or concerns. So let's,
Would there be something that they'd have to let us know what the complaints and concerns were?
that's what
So
they
we can do
were.
our jobs?
So for example, somebody has an ambulance come to their house and they're not happy with the way their
Mhm,
loved one was treated. That'd be a complaint,
mhm.
how they handle that.
I just think we need to know those things sooner than later, so we can,
And communicates appropriate information, appropriate gets to be muddy. How do you want to say that then?
Maybe you include that in one of your reports, the complaints that have come in since your last report.
Yeah, but I don't think we've listed everything in the reports. Regular reports. How about communicates complaints and or concerns to Board of Supervisors? Would that address it?
I would say all. For you.
Because we need to know what's going on, because they'll call us next. That's typically how it works.
prompt handling of complaints and or, let me back up. Prompt handling of all complaints or concerns. In other words, the Board of Supervisors should be the first one notified.
And notify Board of Supervisors. You want that on there? Would that address it?
Yeah, I was just thinking of a cleaner way to do that.
Well, I think. No, the Board of Supervisors needs to be alerted, but I think that the chair is alerted, and then it's the chair's responsibility to notify the other members of the board.
Mhm.
Okay,
Because
and communicate to the chair?
Yeah,
Okay,
yeah, because we need to know that stuff. Because let's say they've got somebody that's maybe has not broken the rules. We need to know that sooner than later.
Why can't he send email to all three of you
they can,
Yeah, they
instead of
could.
just to one?
They can.
Do to all three
yeah,
instead of just the chair.
that's what I asked for all last year.
and that's fine, but it needs to be communicated.
Let's just say to Board of Supervisors, and they can decide, they can tell them how they want them to communicate it. They can either call us or send us all an email. Promptly handles all complaints and or concerns and communicates this to Board of Supervisors
Immediately.
immediately.
Or I just think we need to know.
Yep,
Because how many phone calls do we get from the public that
and then we don't know.
we don't know?
All right. And again, this is a first.
Sure.
So
Who's the poor person has to kind of,
I don't know if it's gonna be Jack or.
Abby's already busy.
You want it, Abby? It shouldn't be that hard.
I missed the first paragraph trying to
Oh.
calm down going, so other than that,
Yeah. No, we've got copies. Operation, you've got a copy of it. I think I sent you one, didn't I? Yeah. Operations, this is one that's duplicative, so if this first bullet point, if you hop down, there's one just like it, and that's where I think the combining of the job descriptions. Develops and oversees the formation of department policies, goals, and objectives. And then there's a develop written protocols, policies, and procedures. Organize, coordinates, and evaluates all function of ambulance services and staff. How about if we cross, the first one doesn't really say a lot.
No, that's,
Let's cross it out. And use the second one. And again, we may, I think parts of that is up above. But let's leave this in for now and maybe later we'll do something with it else. Okay, so that takes us back up to the second bullet point under operations responsible.
Do you want that moved to the top? Is that what you're saying?
Yeah, that'd be fine. Thank you. Responsible for clinical, so instead of responsibility, just responsible for clinical care. And then the rest is the same: staffing, program planning, maintenance of vehicles, equipment, and facilities. Third bullet point ensures safety and efficiency in the workplace, submits policies to the state for approval. Next bullet point establishes policies and procedures for Jefferson County Ambulance Service.
That's in your bullet point, develops written protocols, policies, and procedures.
Okay, let's take this one out then. Thank you. Since we don't have call time, I cross that out. And I just put ensures schedule needs are met. Is that okay?
mhm.
Because, you know, sometimes they go on calls. Okay, the next one, again, it's a wordsmith, monitors crew functions during emergency calls. Responds to emergency calls as needed. Ensures emergency vehicles, and then I added and equipment are maintained and repaired.
So I'll go back up to response to emergency calls as needed.
Yes,
I think there needs to be some clear, at least what I'm thinking,
sure.
to something to the effect of you know, we call it work in the truck, but you know, as needed. It responds to emergency calls. I mean, I guess you can, as long as we clarify to the individual, this is what we mean, that if
That you might need to work a truck.
yeah,
Well, and that's also alluded to above, ensures schedule needs are met, but
right.
I don't know if you want to say it more clearly.
Well, I think that, you know, both Brian, when he was there, and Judy, and
Judy
Judy's
worked.
already scheduled herself
Yes.
this week to work the truck.
That's good to know.
Yeah.
Yeah.
What if
yeah.
you say responds to emergent and non-emergent calls as needed?
How about if we say regularly schedules self to work on a, instead of a truck on the crew?
That or ensure that all, what you said, that all scheduled hours are.
Ensures
covered.
schedule needs are met. That pretty much says it.
And this monitoring of crew functions during emergency calls, that would, and I may be thinking completely wrong on this, but my first impression of that is, how do you monitor the crew function unless you're actually out there?
And do you want to cross it out?
I think so, because I think.
That's fine.
And they have to by, well, I guess they don't have to, but we insist that they mean the director of operations or whomever, well, it was director of operations, that they review all incident reports and sign off on them before they're sent to the state of Iowa. And and by Dr. Marino's requirements, there's certain incidents that require Dr. Marino's signing off on them as well. And then if there's, your medical director is involved, if there's a question as to what they should do on the truck with the patient,
Mhm.
they will contact the medical director.
For all incidents that occur. When are the three of us going to be told about those incidents?
I don't know that you want to know about all those incidents, because I mean, we're talking about
If an employee,
1,600 calls.
I guess I was specifically thinking about if there was an issue with one of our employees. When would we need to know?
That would be a good question for Judy at 1 o'clock.
Right.
Okay.
But when I'm talking incidents, I'm talking about
Just regular.
the emergency
Yeah.
calls or
Yeah. And I was talking about the three of us needing to know, since we're their boss, when one of the employees,
When there's an error.
when there's an error or something, a red flag that comes out, right?
Right.
Like a better word.
So you
That-
crossed out monitors group functions, is that what you?
Yes,
crossed out?
cross that bullet point out, please.
Do you have a headache, Abby?
We did.
We're working on it.
even
Okay.
why, it's because you work out.
So just to recap, so we're all on the same scratch sheet of paper. We got insurers scheduled needs are met, crossed out monitoring of crew functions line. Now, response to emergency calls as needed in or out. That's redundant, isn't it?
Yeah, based on what you're,
Other one says. Now, ensures emergency vehicles are and equipment I added are maintained and repaired, including rig maintenance checks, cop maintenance, medication checks, ordering supplies. And the rest, that's redundant. Fixing equipment, we already talked about that.
Can we go back up to ensure emergency vehicles are maintained
Yes,
in a timely fashion?
and
So that
repaired.
sentence is then gonna read, just so I'm clear, ensures emergency vehicles and equipment are maintained and repaired, including rig maintenance checks, cop maintenance, medication checks, ordering supplies in a timely fashion.
Well,
I wasn't thinking about combining them, but that's a good idea.
I had combined them, but that gets to be an awful lot in one sentence. But it's all basic stuff. I mean, it's things that just are part of the regs, basically. In a timely fashion, add that to the end. Does that work for you, Lee?
yeah, I guess I think it goes without saying, but yeah.
I do think it goes without saying, but sometimes you gotta see it to make sure people understand what you're talking about.
Well, and if you remember the HR way of the meaning of a job description is then you can take that and use as a performance appraisal tool later on too. So you need some detail in there.
Because your second bullet point says responsibility for, which I think we need to talk about medical care, but responsibility for staffing, program planning, maintenance of vehicles, equipment, and facilities.
Mm.
So when you go down here, ensures emergency vehicles are maintained and repaired, and we already say that up there.
So let's see if we can get rid of that one.
And I have a question,
Mhm.
and maybe it's a question for the medical director or Judy, I guess, or whomever. I'm concerned about a job description that says responsible for clinical care.
Where's that at?
Well,
It's a second bullet point.
Oh, see, that was, I think, in both of the job descriptions, and this has been combined.
The only thing, and I always think in terms of lawsuits. And when you say things, your unintended consequences sometimes rear their ugly head. And I'm thinking that the clinical care is the responsibility of, in this case, JCHC. You know, they have protocols that they're required to follow. in a manual that was approved both by the state of Iowa and by the medical director. So.
So you
may-
want a different terminology.
Yeah, I'm just
How
thinking
about
that,
patient care?
It's definitely in both of your job
Yeah.
descriptions from before.
yeah,
How about patient care instead of clinical care? Because that, they're
Yeah,
caring for
okay.
patients. So,
yeah,
okay. So they're responsible for patient care, comma, staffing. Okay, so let's go back to the duplication with the rig maintenance.
oh, excuse me.
You could have that second bullet point that talks about the maintenance of vehicles, equipment and facilities and have a bullet point under it
with the rest.
that specifies it more, so.
So move that rest, that other, the cot maintenance, mid checks and all that up. That's fine, Abby. Good idea.
Make the print the same size, though, would you?
Yeah, I
know
know.
for sure.
Hey, this is what happens when you combine two job descriptions. Um. Okay. Do we have this addressed? Regenta develops written protocols, policies and procedures. Organizes, coordinates and evaluates all functions of the ambulance service, and I put in staff, but that is up above now.
Well,
Yes.
and you've got, unless we took it out, you've got to do it where to go.
We took the first bullet point up,
Okay,
out.
and then there's another one here.
I think this is it.
We crossed off
Ensures
establishes.
safety and efficiency in the workplace, submits policies, the state for approval, then right below that, establishes policies and procedures for Jefferson County Ambulance Service.
We took that out.
Okay,
Okay, let's go down to where it says cleans and maintains. I put ensures the ambulance building ground and grounds are clean and maintained. That's what I rewrote. Does that work?
Yeah,
Handles employee discipline issues in conjunction with the county's HR consultant. And I put added and county attorney as appropriate.
so at what point should the supervisors be made aware of that?
That is a very good question for which I have not included an answer.
I have a question.
That's a really good answer, Dave.
Going back to that previous one, ensures ambulance building and grounds are cleaned and maintained. Is that what you said?
Yes.
Okay, thank you.
Now, the other thing we could do. How about if we put county's HR consultant, comma, county attorney, comma, or county attorney and board of supervisors as appropriate?
What do you mean as appropriate?
Well,
Shouldn't we be informed of all employee discretions?
yeah. So I know. I'm trying to think of Dwayne. He hasn't recently, but when he first started, he had some that he'd say, hey, I had to talk to somebody about whatever.
well, I think you can have your. I guess, let me put it this way. How deeply involved do you want to be in that? I mean, we have an HR, we have a county attorney. You know, do you want to know everything going in, or do you just want to know after the fact that this has happened and why?
What would after the fact mean to you? Would it be timely or like when we?
Well,
find
I
out
guess
from
the
bar?
question is, okay, so we're spending all this money on an HR and the county attorney has been involved. So if your director contacts HR because of a perceived problem and how to proceed, I mean, that's the person we hired to handle that and in conjunction with the county attorney. Now, are we going to be part of the disciplinary process or just knowing that it's taking place and what the end result is?
I don't want to be part of the disciplinary process, but I think it'd be good to know that's happening. So if we have an opinion or something we want to say, we should be able to do that
Well,
as
that's what I mean. I
the
didn't know,
bosses.
I didn't know where you were at, where you wanted to be at in the process. In other words, in this, because it's a step-by-step process. I mean, if the first step of the process is to contact, let me rephrase that. If the director determines that HR needs to be contacted,
Mhm.
that would be the first step in the process. Maybe the first step in the process is say, hey, Abby, you can't wear heels around the supervisor. Then if she wears heels, then we have.
Well, because
I got
that would make
today.
her look taller than
That's
most, some
exactly
of
my
them.
point, and she already is. And so my whole point is that you have the initial conversation between the director and the employee. If it continues, then the director goes to HR, says, hey, I need help, how do we proceed? And so at that point, where in that conversation does the HR consultant say, we proceed this way? And then does the director reach out to the supervisors and or to the chair or via email and say, hey, working with our HR consultant regarding a disciplinary issue that involves, I don't know.
Mhm.
You see,
It should be nice to know way ahead of the community knowing that.
well, right, no, I agree. I agree.
Or maybe I've heard it from a bar in town.
If I had my way, we would just eliminate social media. But I don't have my way, so, because the attorney says I can't do that.
That's a smart attorney.
Is it? Okay, well. You know,
All right, so
so I mean, you could just, so where is that at? Handles employee discipline issues in conjunction with the HR consultant, you said, and the county attorney, and the board of supervisors are
And-
apprised.
and notify board of supervisors.
Well, I just say that the board of supervisors are continually apprised of the process.
Yeah, because there's,
I would agree with that. Can you repeat that?
because
Yeah,
I know there's
yeah.
been times
Abby, repeat that.
that Brian worked with Jack and it was stuff we didn't need to know. And there's
But it's
times we
stuff
need to
we
know
need
stuff.
to know. Think sometimes we need to know.
Right,
Well, and then there's the issue though, too, if the employee decides, if he or she, in any of the departments, decides to take it public, obviously that's up to
Oh,
the
yeah,
employee.
yeah.
Um,
now the other thing we could do here is just put according to the employee handbook, because all that's in there.
Actually, that's probably a cleaner way to say
Yeah.
do that, Dee.
okay,
Yeah, and just put handles employee disciplinations according to the employee handbook. Yep, job description's fine. All right. And then we already have the other operation. I crossed this one out because it's up above the, the other duties as assigned.
So cross them.
Yep. Now, I don't know why we have so many categories under here, but I thought let's leave them for now and see where it takes us. Crew members encourages input from crew members. Instead of works with crew members, I just crossed that phrase out and put provides leadership support and assistance with any concerns regarding ambulance service. Is that redundant or is that necessary? There's some thought that job descriptions ought to be 1 or 2 pages, and this one is 3. Well, of course, it's combined, so that's not fair yet. I do think this one needs to be in, communicates effective performance measures for each crew member. And then
I do have a question.
Yeah.
On that last bullet point under crew members, schedules continuing education. Just from sitting in meetings, isn't that something that the crew members are supposed to be responsible for themselves?
they do some group ones.
I know that there's some that they do together, but
That-
not every single
Right.
CE class is,
Well, and at least the way I see, right, there are continued ed classes, that they to keep up their certification. And where's that? The coordinates training for the new staff, we have policies and procedures in place and how we do our operation. And that training is required for everybody that comes in. And, so I think that that's what it means, the continuing education training sessions for paramedics.
so those classes on.
If they
on
could
policies and
schedule-
procedures.
Right, if you, the continued education, if you can, schedule, not schedule, but if you know of, I don't know exactly how to put it, but for example, Mark schedules training for his staff. And then they close the doors. Well, we can't close the doors, but if you know of training that's available, a lot of the hospital has a lot of training that's available to get continued ed hours. Kathy Giverson has a lot of training for the hospital where those EMTs and paramedics get their continued ed hours. It's more, I think, letting people know what the availability is. You can't schedule it, or I'm sorry, we can't schedule it, meaning the ambulance service, because we're scheduling the crews to work, so they have to know what their schedule is to be able to, whether they can attend those or
But
not.
they can tell them what's available so that they can be
Right.
responsible for the classes
Right.
that are
And
necessary.
they usually have a list
List.
of classes and stuff that. And I know like, Darren's fiance, she's going to Southeastern and she's doing firefighter training over there.
In addition to her position,
Yeah,
only make her better.
yeah, so she is, works for Libertyville Fire. So,
So this whole crew member section, you wanna,
well, it coordinates training for the new staff. That definitely would be the director's responsibility.
yeah, and I think we could just do a period there. I don't know that we need to list everybody. Cause they need to coordinate it for all new staff regardless.
Because I think if I'm not wrong, and I could be, but I think if I'm not wrong, and Joe may know this because of Jacob, but training sessions, continued ed training sessions for paramedics, et cetera, that trainer needs to be certified by the state of Iowa to conduct those.
Mhm.
And so, you know, if you don't have that certification, so your director may or may not have that certification.
Right. That's why they need to coordinate getting that done,
Right.
whether they do it or somebody else does
Right.
it. But, excuse me, but I think it'd be okay to get rid of all that stuff listed in the parentheses, because that's basically your whole staff, just, yeah. So let's leave that section and go billing and accounts payable manages the ambulance department. Payables, accounts receivable, and billing system available to community for billing questions. General questions and provides information, and let's cross out public relations. Let's just say available to community for billing questions. Can we just do a period there? Seems redundant. Where's my brain tired, Susie?
Available to the community for billing questions, period.
Yeah, what do you think? Because it's all under billing.
I agree with that. It's too much.
Right. Now, the rest of it, the good news is, doesn't seem as redundant because it's the same pretty much for most people. Although I do have a lot of crossed out in this next section because it's already everywhere else. Required knowledge, abilities, and skills. And I just put capital K, knowledgeable of all state and federal rules and regulations pertaining to ambulance and EMS delivery. Serves as a paramedic and responds to emergency calls, period. Oh, and take out during scheduled work hours, just put calls as necessary, because this is where, you know, if they have to come fill in a shift, which I know Judy's done, they do that. Ability to lift greater than 50 pounds. Okay, here's what I crossed out because there's a lot of redundancy. Ensures that call time is covered, cross out.
Redundant.
Proven knowledge of billing policies and procedures to ensure timely reimbursement. All that is up above. And this is all stuff I crossed out. Maintains effective working relationship with a wide variety of persons. Now, if you want to put that elsewhere, we can. But that's kind of already in the positive leader. Or leave it in. I'm not tied to that. I just thought at the time I went through this, it looked fairly redundant and we had it addressed.
So positive leader, I would say,
Or you want to keep the maintaining effective working relationships.
mm,
I think we can get rid of the plan and analyze department operations, develop alternatives and determine costs. We already addressed that with budget.
Cross it out.
Yeah. Preparing them, well, this is me. I'm open to other ideas. We are under required knowledge, abilities and skills, and there's a lot of duplication there. So we're getting rid of a lot of that. Because it's early on in the job description. Prepare and administrate an annual budget, that's earlier, so I took that out. Supervise staff and ensure safety, we talked about safety earlier. Work and communicate effectively with county and city officials, volunteer staff, blah, blah, blah. We already had that earlier. And the prompt handling of consumer complaints was earlier. So if you take all that out of there, what is left is the first bullet point. And take out during scheduled work hours in that one. Ability to lift greater than 50 pounds is there. Takes initiative, develops ideas, and here we need a wordsmith. Do we need those? Takes initiative, develops ideas, and demonstrates problem solving? Does that work? We need a verb in there.
Could you combine positive leader with that?
Yeah,
Positive leader that takes initiative, develops ideas and problem solves.
good job, yes. Is that okay with you guys?
Yeah.
Okay. And then the rest of it's gone in that section. It was duplicative. And the qualification should be fine, because that was pretty standard with them.
well, the one where it says supervise staff and ensure safety in the workplace.
Mhm.
You know, under staff supervision, I also think the director should be a member of the safety committee. The county safety committee. In other words, we're being specific about.
Would it be the director or could he or she designate somebody? Because I'm thinking about some other departments, because Dwayne's not on it.
Well-
That's not, isn't Elizabeth, not Chauncey.
You know, I guess I think, I always think about the money and I'm thinking. The position that we're looking at would be something that would just go to a meeting. Once a month, a safety meeting. If they would send a surrogate, that would cost us. An hourly rate. Just thinking about the money.
The only issue I see there is if they've scheduled themselves on the truck, they may have to leave.
Mm.
You mean the director?
Mhm.
Yeah, of course.
Don't have a strong.
And I think that'd be easy because the safety committee meets once a month
Yeah,
for an hour.
Yeah,
So the director should be able to handle that.
okay.
and they're already on the advisory committee. They meet with them whenever they meet, which is not once a month. I think it's
Once every
Quarterly.
quarter.
quarter.
Correct.
So we're putting that supervised staff and ensure safety in the workplace back in,
And
and then adding,
attend safety committee meeting. All right, the rest of this should be okay. It's the usual qualifications, minimum training experience, blah, blah. Unless you want to change anything there, but. And then the last page is all the same stuff that we did when we first did them.
you have in here under physical requirements,
Yeah,
ability to lift greater than 50 pounds. So does that need to be under the required knowledge, abilities, and skills?
Well, earlier I thought you had in there where it said of being able to lift 50 pounds.
It does, under,
under required knowledge, abilities and skills.
Yeah, I would say that that should be under, like it says, under the
so take
physical.
it out of the ability and skills.
I would. Or-
Yeah, but the question I have is, on one, you say ability to lift 50 pounds. On this one, you're saying ability to lift greater than 50 pounds. Where does that stop?
At
Is it
50 pounds.
150?
Okay, where's the greater than?
Well, and that
It's on
line
this
that
page.
she was just talking about, under
Under-
physical requirements.
Physical.
Horizontal.
Well,
is
let's
for-
use this, let's take one away then.
Well, that's what I'm simply asking. Horizontal and vertical reaching motion is required. Ability to lift greater than 50 pounds.
What about just this ability to lift? Oh, they both.
They both say the same
do they?
thing.
I-
Let's get,
Greater than 50 pounds.
I
it
didn't see
seems
that.
like if I'm applying for this job, I'm gonna look at physical requirements and say, can I lift 50 pounds? I'm not gonna jump all up through it, so let's get rid of a required.
What do they do? Excuse me, what do we do?
Because it's
in-
required if it's over here.
But we send them to the hospital for,
Back assessment.
Back assessment.
right, and what is it that they make them lift there?
I don't know.
We went through that when we hired him, but I forget. When we
And
wrote
I'm
all
thinking
this.
I think it's 50 pounds.
It's whatever we say, because we have to send a job description
Right.
with, remember, we had to do, oh, we'll have to update that too with the hospital
Right.
once we get this done.
No, and that's fine if it's been in there, I mean,
Because we had to send
Yeah.
job descriptions over to them, so they knew what they
Right.
had to assess it to.
right. I'm just questioning,
No, that was
the
duplicative.
greater than 50 pounds has a no end to it. Because if you can't lift
How
100,
about
Maybe
we,
should you just say at least 50 pounds?
or a minimum of 50 pounds, is
Yeah.
that,
Yeah.
is that okay?
yeah.
Let's say ability to list,
That's one of
Lift
the
at
reasons
least
we
a
spent
minimum.
$40,000 on those cots.
I was just,
a minimum of 50 pounds.
I was messaging Chris Estel to see if she could tell me
Oh, okay.
what that
All
requirement
right,
is.
and then take it out under there.
Environmental conditions, no snow.
If you could write it and make it happen.
Yeah, well,
Okay. Do we have a rough draft that Abby can read to make into a prettier rough draft?
Yeah,
Can I have your,
You can have mine.
I mean, I've been writing on mine, but
Yeah.
I didn't get
If you
the
can
first
read-
paragraph.
If you can read mine, you can have it.
so when would you like to have this done so we can look it over and approve it?
it's not done already.
Can we,
Here you go.
Can we put this on the agenda next week to approve? So that means you need to send it to us this week so we can each.
Are we gonna
read
have
it.
another meeting this week?
At 1 o'clock.
Yeah, but it's not on that agenda.
Other than that,
You,
Do we
I was
want,
just answering the question.
do we want another meeting this week to work
Yes.
on this so that it's fine tuned to go?
well, I just think
Cause I'd like to
the
get this
the
posted.
sooner the better.
Which
Says
means-
Abby's having a short week, so.
And we'll get in trouble with Abby for having another meeting.
I
Sorry,
need to
Abby.
talk with Fred Hickenbottom and see if we're eating again this week.
She says it depends on job duties.
mm,
All right, this is May.
It is
Yeah.
May. Tomorrow-
Friday morning works. Oh, we wouldn't have it on our agenda by for Monday then. I
I
could do Thursday at 10.
Or Wednesday at 8.
I could do Wednesday at 8. I gotta be done by 9:15, but the next round on this should go really fast.
You have what you need.
I've
Abby.
got Russ Board with
Yeah, how about Wednesday at 8? Is that okay with you? Or 8:10?
Or 7.
Can you give me just 1 second?
Yep.
When does your early voting start?
Next Wednesday.
Yeah.
Oh, wait, I've got a 9 o'clock, so it has to be 8, but it shouldn't take long to do this.
D, I'd like to add that
But
thing that we tabled back on.
to what?
I know, but you're the chair, so I thought it's you.
Wednesday works.
Okay, 8 AM, please.
Consider the
And you want,
opening bids to evaluate the process and operations of
and you want that on when?
Wednesday.
Wednesday?
Mhm.
Susie wants to add something for Wednesday.
Are we doing this as a work session and then as a discuss and consider for this job description?
Oh, I was gonna do this discuss and
Okay.
consider Monday, because that gives us time to digest it, but I don't care. I mean, this is not new. We
This is just a
wrote it.
work session on
Well, Susie
Wednesday.
was wanting to add something else.
That would be a discuss and consider.
Yes, I got that for the job description. Is it a discuss and consider or
For
just?
Wednesday,
Yes.
I don't know.
Well, if
What do you
you've got, if Abby has this typed up in a fresh form and we can look at it,
And we can cross it out and say, approve it with these changes. We could.
I just think the
I could
sooner
get
we
it
get
posted
that,
this week.
we get that in the paper, advertise that, the better.
Well, I
Jack send this to me. Because I think you sent it to me
I
as a
sent it to
PDF.
you. Oh, that's probably how let me, oh, yeah, I've got what he sent me.
Can you send
Hey,
it?
it's gonna scan back in and see what you're gonna do.
Hold on,
You tell me.
hang on.
I'm just asking.
Whatever the quickest, easiest thing is for you to do.
I can
My
ask him to
opinion.
send you just when you can change.
Regardless of whatever we finally approve needs to go to Jack.
Mhm. Let's see. I'm gonna see if I get a Word copy of it.
There's somebody in the waiting room, D.
Really? Anonymous. Mm,
Is back.
mm,
Of course they are. It'd be nice to have a name.
Anonymous.
Well,
Well,
we
we
can
know who that
recognize the
is.
voice. We,
All right, let's see. Let's see.
Well, they didn't find any treasure this year. But they talk like there's gonna be another season, so who knows? Well, I'm not a treasure. Huh?
I want to find treasure.
Well. If you wouldn't spend all that time working out, you'd have more time to put treasure on.
Probably, that's true.
You got your RV all de-winterized?
No,
Either have I.
Yeah, no, that's what I've got is Jack's version. But you can change it, because I started trying to type on it last week when I was working on it, and I could forward it to you,
I haven't.
okay? Otherwise, just email him and ask him for a. But if I can do it, that's pretty basic.
We quote you on that.
Okay.
I used to be really good at Excel and all that, and I worked on that Excel spreadsheet last week, and I'm like, oh.
Okay, so the job description is as a discuss and consider, so it gives you the option
Yeah.
for
that's what I-
Wednesday at
Yeah.
8.
But that would be after we do a work session, so we can go through it again. Or do you want to go through it as we discuss and consider it?
Well,
It should be in pretty good form. We're just gonna wordsmith it. I just need to know. I know.
yeah, I think that the sooner the better, if that's what we have to do.
Could we do this? It will not take you long to do that. Could you please email that to us when you get it done? And that will give us probably tomorrow to look at it. So we can come with some thoughts in mind. Okay. So yes, put it on as discuss and consider, and we may or may not act on it.
Okay. And then discuss and consider bids.
So
Do you want that
on your
on?
agenda,
Can we have it be 8:15?
I gotta be out of here by 10 to 9. I think
When, Abby, you come to work at 8, you need 15 minutes to get ready for us. Is that what you're saying?
she's gotta have a couple drinks.
Uh-huh.
we do 8:10.
On your discuss and consider regarding the job description. So you need to discuss and consider the job description and posting.
Yeah.
So
if you
we can
don't-
talk about where we want to post it.
Well, I'm just saying that if you discuss and consider it and you're in a hurry to get it posted, well, now you can't do anything until the next agenda.
Yeah.
So if you put,
Good job.
Am
Yeah,
I changing this to say discuss and consider director job description? Because this just says job descriptions.
Okay,
no, it's not your job.
and ambulance director job description.
And posting.
And how do we put that? Just, and we just need to discuss posting, don't we? We don't need to vote on that, do we? I
Well-
suppose put to discuss and consider so that it's
Yeah.
there if we need it.
Yeah.
Better to have it than not.
Right.
Posting,
8:10.
It's
Discuss
not-
and consider ambulance director job description. Discuss and consider posting ambulance director job description. Ambulance director.
ambulance
Siobhan?
director position.
Position.
New ambulance director position. I need a calendar like that.
Mm-hmm. Our voting equipment vendor.
Alrighty. You got it?
So
1 o'clock. Today.
what's on the agenda for Wednesday? Could you read it back to me?
Yes, 8:10, discuss and consider ambulance director job description. Discuss and consider posting new ambulance director position. Discuss and consider bids to evaluate the processes and operations of Jefferson County Ambulance Service.
Can we do that all in 35 minutes?
If Lee and I don't talk much, yes.
That just answered your question, didn't it?
I guess we can always table something if we have to.
36.5 minutes, we're done, okay?
Bring duct tape, okay?
Okay. All right, we're done. For now. Thanks, everybody. Do we
Lee,
need
you'll
to
have to
formally
talk
adjourn this?
shorthand.
Yeah, the short part I can accomplish.
Motion to adjourn.
So
Okay.
moved.
Second.
Second.
Adjourn by